Hello everyone! November is Diabetes Awareness Month, and today we have Rachel Ossier here to talk about diabetes. But before we start, Rachel, can you tell us a little bit about yourself?
Hello everyone, my name is Rachel Ossier. I am a registered nurse and I mainly work with cardiac patients. A lot of my patients have diabetes and my mother has diabetes, so I'm very familiar with this topic.
Thank you so much, Rachel, for being here with us. Can you tell us what diabetes is in simple terms?
Sure. Diabetes is a metabolic disease where the body has trouble using a special sugar called glucose. And when this happens, your blood glucose levels can get too high. When your blood glucose levels get too high, this can cause a lot of damage to your heart, blood vessels, your eyes, your kidneys, and even your nerves.
So, how prevalent is diabetes in our community, and are there any risk factors?
There is a higher prevalence of diabetes in the South Asian community in comparison to other U.S. ethnic groups. Some non-modifiable risk factors include your age, your gender, your ethnicity, and your family history. Some modifiable risk factors include obesity, your diet, and a sedentary lifestyle.
Can you describe the different types of diabetes, like gestational, type 1, and type 2? How do they affect people differently?
There are three main types of diabetes. The first one is type 1 diabetes, also known as juvenile diabetes, which is mainly seen in adolescents. It is caused by an autoimmune reaction where the body's own defense system attacks the cells that make insulin, which is a hormone that helps control the sugar in your blood. Therefore, it can produce little or no insulin. The second type is type 2 diabetes and is mainly seen in adults. This is when the body produces little or it has a resistance to insulin. The third type of diabetes is gestational diabetes, and this is mainly seen in pregnant women. It is usually diagnosed by a blood sugar test, which is taken during pregnancy. Sometimes this can go away after the baby is born, but other times gestational diabetes can increase the likelihood of developing type 2 diabetes in women later on in life.
So, what are some common symptoms of diabetes, regardless of someone's age?
Some common symptoms include feeling very thirsty, frequently having to pee a lot, feeling very tired, losing weight without even trying, numbness or tingling in your hands or feet, or blurry vision. And if you're experiencing any of these symptoms, you should talk to your doctor.
So, how can a healthy diet play a role in managing diabetes? Do you have any nutritional tips for us?
You should eat portion-controlled sized meals and snacks to help regulate your blood sugars. Your plate should have more vegetables such as leafy greens, more lean proteins such as chicken, dal, or chana, and a smaller amount of carbohydrates such as rice or breads. For young children, try to limit your sugary snacks and drinks. Some foods make your blood sugar shoot up, so if you want to manage your diabetes even better, you should look at the glycemic index of certain foods. The glycemic index is a number which can give you an idea of how fast your body is able to convert that certain food into glucose. The smaller the number, the less impact the food has on your blood sugars. So for example, if you have the option of using white rice or whole wheat chapati or roti, you should choose the whole wheat roti or chapati because it has a lower glycemic index.
So, how important is physical activity in preventing or managing diabetes? And do you have any examples of exercises that anyone can do?
Being active is like a secret weapon against diabetes. Your body uses glucose for energy, so staying active helps regulate your blood sugars. Activities like walking, playing sports, and even dancing are great ways to stay active. There are activities here at Sasdac for all ages, from young kids to grandparents. We have the walking club called the Sasdac Striders, and we have sports in the gymnasium from Monday through Thursday from 7 p.m. to 10 p.m. And we also have on Wednesdays the Golden Year Ministries, where they provide yummy snacks, healthy snacks, and exercises for the older generation.
So for our younger audience, what advice do you have to reduce their risk of diabetes?
There is no way of reducing the risk of type 1 diabetes in young children, but it's still important for them to maintain a healthy lifestyle by eating a clean diet and staying active and maintaining normal blood sugar levels and getting regular checkups with your doctor. For children who do not have type 1 diabetes, it's still very important for you to make healthy choices very early on in life. Try to eat more fruits and veggies and continue to stay active. You should also talk to your parents about making healthy choices as a family together.
So what about adults? How can they stay vigilant about their risk for diabetes? Are there any tests or screenings they could consider?
So adults should keep an eye on their health by regularly getting checkups with their doctors. Some blood tests include hemoglobin A1C and checking your fasting blood glucose levels. If you have any concerns or family history, you should definitely talk to your doctor about that.
So we talked about young kids and adults. What about our elderly population? Are there any challenges that are specific to them when it comes to managing diabetes? Do you have any advice for them?
Diabetes can be more challenging as we get older, but it is manageable. It's important to talk to your provider and stay on top of your medications and your blood sugar levels. You should be monitoring your blood sugar levels at least before meals and before bedtime. And continue to stay active by at least walking 30 minutes a day and eating foods that are lower in the glycemic index.
For anyone watching who has diabetes or is trying to prevent it, do you have any resources that are available in our community for them?
There are many resources in our community and online that can help. You can find support groups, educational classes, and even local clinics that specialize in diabetes care. And your doctor can even connect you with these resources. You can also find information online by Google searching American Diabetes Association or going to www.diabetes.org. It is also important to know that you are not alone and help is always available.
Thank you so much, Rachel, for being here to talk about diabetes. I'm sure that everyone watching was blessed by this.
Thank you, Sonola, for having me here, and I really hope that this information will be useful for many.